Welcome to Doctors on Call. I'm Jenna Miller. Orthopedics is the medical specialty that focuses on injuries and diseases of the body's musculoskeletal system. That's the complex system that includes your bones, joints, ligaments, tendons, muscles, and nerves that allows you to move, work, and be active. Today, the orthopedic field has expanded to encompass many subspecialties in the treatment of a wide variety of musculoskeletal disorders in patients of all ages. Podiatrists are medical specialists who help with problems that affect your feet or lower leg. Dealing with foot pain is not a great way to spend your life. Finding a podiatrist who's able to treat your foot problems might completely change your health. Orthopedics and podiatry, that's our topic today on Doctors on Call with Dr. Joshua Boone.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Regional Hospital, experts, neighbors, friends.
Dr. Joshua Boone, DPM, graduated from Midwestern University in Glendale, Arizona. He became board certified in foot surgery and reconstructive foot-ankle surgery through the American Board of Foot and Ankle Surgery. He offers comprehensive surgical and non-surgical care for the foot and ankle. Dr. Boone's professional interests are foot and ankle sports medicine, ankle instability, deformity correction, and arthritis of the foot and ankle. Dr. Boone is on staff at Central Kansas Orthopedic Group in Great Bend. Give us a call at 800-337-4788 with your questions about foot pain and podiatry on tonight's Doctors on Call. Thank you so much for joining us tonight. We've got lots to cover, so we'll go ahead and with some of our own questions while we wait for those calls to come in. First of all, when is it recommended to see a podiatrist?
Sure. Well, I think it would be if your foot hurts, your ankle hurts, your lower extremity hurts, and it's not getting better through things that, make sense. Resting it, maybe decreasing your activities that are aggravating it, changing your shoes. If those type of common sense things aren't working, then it might be time to have another pair of eyes on it and see if there's more to it than just a little bit of overuse.
How long should a person go before it's like, we need to get you?
So it depends what it is. Certainly if you fell and your toes are going this way and your ankle's going that way and there's clearly an injury and you can't walk on it, that's a good time to go see someone. So in general, if you can't bear weight on it, without significant pain, that's probably sooner rather than later you want to get that looked at. If it's just kind of a nagging kind of chronic type thing, you might give it a week or two with using over-the-counter medications and remedies, and if it's not making progress, might be worth getting it looked at.
And how does someone go about finding a good podiatrist?
So the word of mouth is where most people go,
Sure.
And so that's always one way to find out. I belong to a couple professional organizations that post that. American Podiatric Medical Association is one, APMA. They have a Find a Podiatrist tool on their website. Another good resource is American College of Foot and Ankle Surgeons. It deals with DPMs, Doctors of Podiatric Medicine, who are trained surgically to address those things as well. So both of those websites, APMA and ACFAS, American College of Foot and Ankle Surgeons, are both good resources that have board, certified, board qualified tools to find members of those organizations.
Sure. What are the most common orthopedic surgeries that you deal with?
So I think one of the most common things that I do is fracture repair. And so injuries, ankle fractures are fairly common. So as far as surgical procedures go, that's probably one of the most common things I see is different fractures of the foot and ankle. Ankle sprains are very common with injuries. So those are the most common kind of injury-related procedures. As far as elective, non-trauma type situations, I do a fair amount of deformity correction, whether it be bunions and toes, toe deformities, or something that's a little bit more involved with the entire foot and ankle. So deformity correction is what I do a fair amount of. Those are probably the most common: fracture repair and deformity correction.
Describe what arthroscopic surgery is.
So arthroscopic surgery has to deal with looking inside with a camera inside a joint. You know, traditionally, before the technology was there, you would just make a larger incision and you would look inside and see what was going on. That has a few disadvantages. There's obviously more scar tissue with a bigger incision. As the technology has improved, we're able to go in with a camera. The ankle joint is the one I most commonly do, and you can look inside and diagnose more subtle pathology, and also save the patient a lot of time, downtime from healing through two tiny incisions instead of a larger incision. And so it's just a way to look right inside without having to open it up the whole way. So.
Okay. Well, we are going to go to the phone lines. We've got Rhonda on the line from Garden City. Hi, Rhonda. Go ahead with your question for Dr. Boone tonight.
Okay, in 2017, I broke a bone next to my toe, in my little toe, and I didn't know it, and I walked on it for like 8 months. I'm getting a lot of feedback. I'm not even in there with my TV. Anyway, the toe was a bone broke, and I got it repaired about 8 months later. It kind of healed, but it tore the tendons in the foot, and I'm still having pain from that. It hurts more than it doesn't. And when I walk, sometimes it's almost like you've got a sprained ankle.
So I don't know if I understood everything. So if I understand, you had something that was stuck in your toe. Is that correct?
No, a bone broke behind my little toe on my foot.
I see.
And I was on it for about 8 months. And then after it healed, they found out that a tendon had been shredded. So they went in and fixed it.
I'm a little hard. So you broke a bone, from what I understand, behind your toe, and you did have surgery, or you didn't have surgery?
I did have surgery.
Okay. So do you know which bone you broke? One of the metatarsal bones, or?
It was one of the little ones on the side.
I see. Okay. On the pinky toe side of the foot?
Yes.
Okay. Yeah, and you're still having pain with it, it sounds like?
Yes.
Is there still
having pain.
Is there still some type of surgical hardware in there, a screw or a metal plate or something of that sort?
They said they had to put a mesh to fix it.
Well, you know, one thing so what I see from time to time with broken bones, particularly in that part of the foot, you don't have a whole lot of soft tissue coverage in that area, and so sometimes that hardware can be a little prominent and rub and be there. So that's, you know, if that's not the case, it may be some bones are harder to heal than others. It's a little hard to say without seeing x-rays and seeing what it is, but in general, I kind of tell people it takes a good year or so, you know, a year, sometimes more, to heal from a involved, you know, foot and ankle type surgery. We you know, for the hand or the shoulder or something, we don't walk on our hands, we don't walk on our shoulders, so the feet just have a lot of pressure on them, and so that's one reason at times it can take a little while, you know, to heal. You know, sometimes if the hardware is prominent or things aren't healed, maybe there may be something to do there, but just depends on the situation, I guess is what I'd say. So.
In what cases do you request a patient to seek an MRI?
MRI is typically done when x-rays don't give us all the information, I guess is what I'd say. Or x-rays show us bones, as we know. They can show us things MRIs can't. So it's when we're looking for a tendon issue, a ligament issue, or sometimes there's things that can show up in the bone with a bone bruise or a lot of damage to the bone that's not present on x-ray. It just gives us more information and can really kind of narrow things down if we don't get all the information we need on an x-ray.
Sure. And what are the different kinds of fractures that a person can suffer?
So one of the most concerning type fractures is an open fracture. Like the name sounds, an open fracture is where there's a break in the skin and the bone is exposed to the open world. And you know, there's a fair amount of farm injuries, oil field injuries in this part of Kansas, and so those, you know, if you don't get to them fast, they have a higher rate of infection and problems. So open fractures are certainly concerning. The probably next step down would be a fracture dislocation, where the bones move and are out of place, and that can put strain on the nerves, on the blood vessels, and can lead to some problems if that isn't set in a fairly urgent manner to get everything lined up where it needs to be. So those are kind of the more concerning, and then you have non-displaced or stress fractures, different types. Those need time and need treatment, but they're not quite as urgent as the others.
Sure. And do you treat a child with a broken bone differently than you do an adult?
At times, you know, children's bone has a little higher cartilage content, so they're a little bit more bendy than us, I guess I would say. So they sometimes are more prone to get a sprain or something, but they have growth plates because they're not fully developed, and so you see more growth plate injuries. And so that's something that we're always sensitive to. If there's a growth plate injury, we watch those a little closer and make sure that if a break is around the growth plate, that it's healing appropriately. So yeah, we watch those a little bit differently.
Sure. So what are some of the causes of swollen ankles and feet?
Swollen ankles and feet. Well, there's a laundry list of things that can cause that. Certainly there's some medical conditions that can cause that, such as kidney-related issues, heart issues, things that affect the circulation. And so, you know, one thing that's important with any specialty, we get so specialized sometimes, we just think, well, it's all coming from the foot. Well, obviously there's a person connected to that foot, and so you have to look at the big picture and see if there's more at play, you know. So swelling can be due to vein problems, as the veins help return the blood up into the legs, and so if the veins aren't working well, those veins have valves, so those valves can wear out over time, and so a lot of people will wear compression socks, compression hoses, that type of thing to get fluid up there. Certainly significant arthritis where the joint has worn out will cause swelling, you know. A sprain or an injury will do it. So those are the most common medical reasons, and then arthritis and more local problems localized to that area.
Sure. So we're going to go back to the phone lines. We've
Sounds
got
great.
Stephanie on the line from Hayes. Hi, Stephanie. Go ahead with your question tonight for our podiatrist.
Yes, I have very high arches, and sometimes it bothers my feet. Sometimes it doesn't. I have bought some, just online, I found some slip-on arch supports. Sometimes that helps, sometimes it doesn't.
Sure.
I was just wondering if you had any suggestions for me.
Sure. So, do you mind if I ask you a couple questions about your high arches? Or do they run in the family? Is this something family members deal with as well?
I don't really exactly know.
Okay.
It's been something I've dealt with since I was young and a runner in track. I know it. I always dealt with shin splints and my coaches would wrap me up. That was over 20 years ago, but they
Sure.
still seem to bother me.
Yeah. So in general, high arches. There's a genetic component in a lot of people. Same thing with flat feet, but high arches in particular are a little bit more notorious for poor shock absorption on the foot. I kind of think of it, you almost have an internal high heel in your foot, so it's like you're walking in high heels more, and so you just don't have as much cushion. When you have a flat foot, that foot gives a little bit, so there's a little bit more give to the foot when you walk around. One thing that I look for in people who are high arches are to see how tight their hamstrings and calves are. Often, not always, but people with high arches will be a little tight in their hamstrings and in their calf muscles. And so often some stretching, some physical therapy, if we need a little bit more hands-on, can be helpful in trying to loosen those muscles up a little bit. In regards to shoe gear, in general, I find people do better with a shoe that has a little extra cushion built into it. Guess it depends what you're doing. They do make shoes that have a little bit more foam cushion that do have more give to them. As far as arch supports and that kind of thing go, often you can find a fairly decent prefabricated insert that fits well. Custom orthotics on occasion can be a little better, not always, but a custom orthotic can fit like a glove, I guess I would say, would fit a little bit better. And there's different materials. You can have a harder arch support or something cork or a foam type that has a little bit more give to it. So it kind of depends on the foot, but a few more options than that. But I think having the tightness in the muscles checked is something worth looking at and just seeing if that might be playing into it. So does that answer your question, or does that give you an idea?
You might be blind by now.
Okay.
Yeah.
Hopefully that's helpful.
Sure. Okay. Oh, you had mentioned bunions earlier. What is a bunion and what are the treatments?
So a bunion traditionally is what we think about, what most people think about anyway, is a bunion is where the toe is pointing towards the rest of the toe. So, I don't know if you can see my hand, but we have the longer bone, the first metatarsal points this way, and the big toe points the opposite way. And that bunion can start overlapping or underlapping the second toe and can cause irritation there, or it can rub on the outside of the bunion and cause problems with shoe gear. So that's typically what we're talking about. It's a deformity essentially in the foot. It's not a growth itself, it's just the way the toes are aligned. The treatments, a good place to start is looking for a wider shoe. Sometimes if you just have a little bit more room in the toe box in the shoe, that can accommodate the bunion deformity and just let the foot breathe, for lack of a better term, give it a little bit more room. They do have more toe boxes that are wider and can accommodate that, so that's a good place to start. Some people have a fairly flat foot with a bunion as well, and so some of those people who are more flat-footed do a little bit better with an arch support and bunion because that can stabilize the foot. So those are kind of the easy things to try first. If those things aren't successful, bunions can be corrected surgically. There's, I don't know, in school when you go through it, there's, 50, 60, there's multiple different named bunion procedures. Usually they have somebody's name attached to them who came up with the technique. And so what that tells me as a physician and surgeon is there's not one of them that works all the time, or we would all do the same 2 or 3 procedures. So it's a little unique to the type of bunion it is and what else is going off of the foot, but there's different ways to correct it. Yeah, usually it's a combination of doing bone cuts, releasing things that are tight, and trying to get things lined up the best we can.
Okay, back to the phone lines we go.
All right,
We've
great.
got Rosie on the line from Hayes. Go ahead with your question for our doctor tonight.
Yeah, my problem is flat feet. What can I do for it?
Flat feet. Okay. Well, how flat are they? I guess is what I'd ask.
Very, very.
Okay,
And my
well,
whole family has it.
All right. So you've had it from a young age, from what it sounds like. It's congenital.
Yeah, probably because I never wear shoes.
Yeah. Well, that's the start. Where does it hurt? Do they hurt all over, on the bottom, on the sides? Where does it seem to be the worst?
Probably the heel area.
The heel area. Okay. Well, I recommend people to start with trying to find a pair of shoes. And in general, if you have something that has a little bit more buildup in the arch, that's going to support the arch. Some people who are very flat-footed don't even tolerate a tennis shoe with an arch because it's so flat it irritates it. But in general, if going without shoes, and a lot of people are barefooted type people, and I get that, I understand that, but at the same time, having a shoe with an arch support is going to take some of the strain off the bottom of that foot. And the heel in particular has a structure connected called the plantar fascia. It's a thick band of tissue, and it's pretty close to the surface. So you got the skin on the bottom, a little bit of fat padding, and then you have that plantar fascia band. So a lot of people will get heel pain from that plantar fascia getting stretched out. So a good place to start is wearing shoes, more often than not, and kind of go from there, and then you can kind of go up the levels of aggressiveness. An arch support, like we talked about, a brace. Surgery is something to do, but flat foot surgeries, it's not a cakewalk. It takes several months to recover from reconstructive surgery like that. But it's available, so it just depends on the flat foot. But wearing shoes more often is a good place to start.
Okay. We hear a lot about hip and knee replacement surgeries.
Sure.
What about an ankle replacement surgery?
So joint replacement is something that's been done for a while. Hips and knees are more common because they wear out a little bit more than ankles do. Some differences are ankles, on occasion they'll wear out on their own. Most often there has been some type of injury, and so post-traumatic arthritis is more what we see in ankles. Often it can be something as little as a really bad sprain back in high school sports. Now, a really bad sprain that doesn't heal quite right can leave that ankle just a little loose. Not too bad, because I have people walking in their 50s and 60s who tell me, I had a bad ankle sprain, I kept playing on it, I didn't want to come out, or for whatever reason it didn't really maybe get the attention it could have. But anyway, that ankle being a little loose over time, that joint starts to wear out. And often when they come to me, there's not a whole lot to do. The ankle sprain has come and gone, but the joint replacement has evolved because traditionally we did ankle fusion, where you stabilize the ankle in place with hardware. It doesn't move, and that's a good procedure. It's something I still do from time to time. It just doesn't allow for a whole lot of motion in that joint once you stabilize it. The rest of the foot can make up for some of that, but joint replacements in the ankle have been done more often because there was a need for another option than just a fusion, something that could preserve some of the motion, take some strain off the rest of the foot. And so the technology has evolved and gotten much better, where if it's not quite to the knee and hip yet, it's getting there, because industry has seen a need, and we have a lot better implants than we used to.
Okay, wonderful. Well, thank you so much. Our
Sure.
thanks goes out to Dr. Joshua Boone from Central Kansas Orthopedic Group and Great Bend for being our guest tonight. On our next Doctors on Call, we'll be discussing colorectal cancer. You can email questions to us for our next program. That address is doctors@shtv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.